Hi, my name is Kerry Boysen, and I am a doctor of physical therapy. I have been practicing since 1997, and I've specialized in women's health, pelvic health since 2004. At Restore Physical Therapy, I treat women who present with basically two categories, either underactive pelvic floors or overactive pelvic floors. I also treat women in pregnancy, postpartum stages, perimenopausal women, postmenopausal women, basically anyone from adolescence to you name the age. And I really like to educate women, empower them about how they can live the healthiest life they can specific to their pelvic health. Specific symptoms that patients might have when they come to Restore are stress incontinence, urge incontinence, maybe fecal incontinence. They may be recovering post-birth with stitches, scar tissue, maybe cesarean section issues. Women who are perimenopausal might be dealing with vaginal dryness, having pain with intercourse. Women who've had a history of trauma or abuse often have an overactive pelvic floor, which presents like pain. And again, my role is to examine and educate the patients on what their condition is and then how we can best treat it. So when I have the opportunity to tell a patient about maintaining better vulvar and vaginal tissue health, I start with how they're washing, and I strongly recommend the Balance product. It is pH balanced, it's not going to be drying, and in some cases it can be soothing. And my recommendation is always what I call the trifecta, starting with a Balance wash, and then post shower, if there needs to be any type of moisturizing, using the BioNourish, which has the hyaluronic acid, or Restore. And then for intercourse, using the Almost Naked or the BioNude for the patient who may have some more sensitivities. So when I think about patients who I have recommended the Good Clean Love products to, feedback that I get from the postmenopausal woman who has been hesitant to return to intercourse, anticipating that it's going to be painful, is it wasn't painful at all when I used the Restore. I have women who have dealt with recurrent UTIs, and the education around keeping the tissues more moisturized has significantly decreased the frequency of their UTIs. In particular, a patient of mine took the products home and shared the samples with her mother-in-law, who was elderly, and the cycle of UTI antibiotic was really taking a toll on her health. And within a few weeks of using the moisturizers for her tissues, she was not getting a UTI again, and they were able to break that cycle, which was huge on so many levels. And with the perimenopausal women, giving them an alternative before they use an estrogen only option, they're coming back saying, I'm not going to ask my doctor for estrogen now. I'm only using the wash and the moisturizer and finding that my tissues are feeling healthier. And of course, if I'm recommending these products to my patients, I'm also going to try them myself. And I have seen amazing changes in my own tissue health by washing with the Balance, moisturizing with the BioNourish with the hyaluronic acid. I have decreased the frequency with which I'm using topical estrogen, and I take the products with me everywhere I go now. I love that they come in travel sizes because I don't want to be without them.